Just a brief discussion on your acromion process and impingement syndrome. The term impingement syndrome became popular in the early 70s when an orthopedic surgeon by the name of Charles Neer found a connection between torn rotator cuffs and a acromion process that had bony outgrowths or hooks on their tips. So basically, there are three different types of acromion processes. Number three is known as the hooked one. And this one has been linked to impingement syndrome in several studies. So you can see the shape. This is straighter, hooks a little bit, and this is really hooked. So that's the one that's been linked to impingement syndrome. May make him a little more biased towards getting that. Based on these observations, Dr. Neer then proposed a theory that most rotator cuff tears were indeed caused by tendons rubbing against the outer part of the acromion process, as well as the ligament that is attached to it, called the coracoacromial ligament. Furthermore, he also found that the symptoms of impingement could be relieved in many cases by surgically cutting off the acromion process. This is called an anterior acromioplasty. So they just cut off part of it. Then it can't rub against anything. Years later, another study came out that showed a strong association between hooked acromion processes and rotator cuff tears. The impingement theory eventually caught on, and soon the anterior acromioplasty procedure became the treatment of choice for patients with impingement syndrome. While it indeed seemed for a while that most rotator tears were simply due to tendons mechanically rubbing on the bone, later research cropped up that raised very serious questions as to the simplicity of Dr. Neer's original theory. For instance, studies also show that there are a lot of people with normal rotator cuffs but abnormal acromion process that should be causing wear and tear. Okay? So there's lots of people with these abnormal acromion processes that don't have any kind of wear and tear, on their rotator cuff. Tears on the bottom part of the rotator cuff are much more common than tears facing the acromion process. So if mechanical rubbing really was the cause of most tears, the side facing towards the bony acromion process should show signs of wear first. Randomized controlled trials show that patients with impingement syndrome can get better with just exercise. If the whole problem was just due to tendons rubbing on bone, exercise wouldn't help patients with impingement syndrome, since exercise doesn't change the shape of the bony acromion that is supposed to be the cause of the whole problem here. Today, we know that most rotator cuff tears are not caused by a simple case of tendons rubbing on bone. Furthermore, the impingement syndrome can be divided into two distinct types. So anyway, so there you go. A little bit about acromion processes and rotator cuff tears.